Hi, I'm a doctor from Malaysia. I'm here to talk about the untold truth of the side effects of vaccinations that most of us or most doctors are seeing in this country. In my practice, in my daily practice, I'm seeing about 1/3 of my patients with vaccine side effects. That makes about 30 to 40% of my patients. The side effects are many. I've documented 25 side effects from an overall of 40 side effects that are seen throughout the world. I'll just talk about 5. The ones that I'm seeing most commonly is dizziness, vertigo, weakness, joint swellings, memory loss, erectile dysfunction, and a burst or a relapse of autoimmune disorders like rheumatoid arthritis, psoriasis, right, where they were fully treated or almost fully treated, disease was quiet and it just flared up in the body. However, don't worry. There are detox protocols, treatments that work. Unfortunately, or however, they seem to work very well for those who have taken Sinovac and AstraZeneca. That seem to work best. Almost all of them get better. In Pfizer, because it's an mRNA vaccine, only 70% get fully better. The rest 30%, they get a little better to moderately better, but they don't seem to get fully better. We are not sure about the long-term side effects. For short-term, most of those who got better, well, they're happy. But really, what happens in the long term, I don't think anybody can tell you at the moment. All right? You have to remember what Dr. Robert Malone and Prof. Luc Montagnier told about the vaccines. They told you have to be careful, and they do expect long-term side effects within the first 2 to 3 years for those who have taken mRNA vaccines. I've got a patient, a couple, 2 patients who are husband and wife. They walked into my practice, and the husband's complaining of severe weakness over the last 3-4 months. He works in an orchard. He runs it in a jungle in one of the states. He's been unable to get up from work without struggle. He's got memory loss. He's got erectile dysfunction. His wife's complaining about the same things, memory loss, loss of energy. In fact, she complained after the first vaccine she took in the hospital, in a PPV, she fainted. Doctor just said, "You're scared." But she says that she works in the jungle and in the orchard. She's not scared of anything. She's never ever fainted. Come the second injection, she faints, doesn't recover. They send her to hospital. She's there for a day. She wakes up, and then she goes home, and doctor tells her the same thing. Is this what we doctors are doing? Telling everybody that you're scared from a jab? I don't know what the country is coming to, but seriously, we need to wake up. A lot of my colleagues are reporting increased number of cancers occurring after having taken the vaccines. This is from patients' own feelings, and they're telling the doctors. So maybe we should be talking to oncologists. Maybe we should be talking to the cardiologists about the spikes in myocarditis and pericarditis. Maybe we should be talking to the neurologists in the spikes of strokes or memory loss or shrinkage of the brain. Maybe we should be talking to a whole lot more of doctors in this country and find out what's going on. Alas, I think this may not happen because most of them are scared. Maybe we should ask for a royal inquiry, an investigation into side effects of post-vaccination, right? After the vaccination, we're getting side effects. And then we'll come to the truth. Because nobody can say who's right or wrong. But you do an inquiry, a royal inquiry, the truth's going to come out. Thank you.